Good afternoon. Welcome to this new session of the Transgender in Latin America Symposium. Thank you for being here with us today. I am Inés Aristegui. I am the coordinator for social research and community engagement at Fundación Huésped. Welcome everybody. I'm Luciana Spadaccini. I'm an infectologist working at Fundación Huésped in the research department. I am going to introduce our two speakers. Benjamín Génova from Argentina. He is the General Secretary of Trans, Males and Non-Binary People of Neuquén and Rio Negro. He is a member of the Argentine LGBT Federation and a consultant at the Transmasculinities area at the Diversity Bureau under Neuquén's Ministry of Citizenship. The second speaker is Erika Trejo from Peru. She's part of the Community Advisory Committee of Impacta Peru. She is a medical clinical laboratory technologist. She graduated from Cayetano Heredia University in Lima, and for 12 years she has been working at the Ventanilla Hospital in Peru. Let's start with the presentations.
Argentina's gender identity law was passed in 2012. It is an avant-garde law because it recognizes gender identity from childhood and it requires no proof of evidence to be enforceable. It establishes the right to gender identity, to its recognition, to free development in agreement with their self-perceived gender identity, and to be treated with dignity as per their gender identity. Pursuant to this law, gender identity is the individual lived experience in any way it may be felt in depth by each person. It may correspond or not to the gender assigned at birth. This law is a before and after, in particular regarding trans males, because it was the law that gave visibility to trans masculinities, or actually it allowed greater visibility because there was visibility before it, but after it, in Argentina and in the province or state of Neuquén, we started trying to obtain access to health care in order to modify our bodies as desired, as we desired. The road to achieving this right to modify our bodies, to do a top surgery, etc., looking for information in different hospitals, finding nothing there that would recognize us as persons. The good thing of all that roadmap was that I found others that were traveling the same road, looking for information and access to rights. So we met. Many of us met, and we started dreaming together with the idea of getting organized so as not to have other people like us, our mates on the road, to go through what we were going through. This was a dream, but the dream came true. After 3 years of struggling with public health in the province of Neuquén, where I live, I've been able to make chest masculinization surgery recognized, to have it recognized, and I had access to the surgery in a hospital, a public hospital in my city, a public hospital in the province, and that was in 2015, after which only 6 more surgeries have been done In the province of Rio Negro, which is a province that we also represent with our organization, they've had only 3 top surgeries, and the law has been out for 8 years. Only 3 surgeries in the province of Rio Negro. Very little, very few. And that's why we are still working to obtain real access to those rights that are guaranteed by the law. When that surgery was performed at the hospital, I felt that that required visibility, because in the same way as for many years I had been striving to have those rights, to obtain those rights, I knew that there were others who were also alone like myself. And so, meeting with the people which I had already detected, we got organized as an organization that used to be called only Trans Males, but the name changed in the course of time because others, others who were non-binary mates on the road joined us, and that's why we are called trans males and non-binaries of Neuquén and Rio Negro. The law allows for trans males to be considered. So from childhood, now we're about 40-50 people in the organization. We strive, we fight. Our struggle is giving visibility to our claims, but also gaining access to health care, because it's not just access to health care by way of surgeries, but also with other things like gynecological health care and other things as well, other concerns. Within the national territory, this is Argentina. We are here in Neuquén and Rio Negro in the south of Argentina. But we work along with other organizations. As I was saying, we work in the higher valley of the Rio Negro River, but we do networking with sister organizations of non-binary masculinities that are elsewhere on our territory, and this is how we have been able to identify where to get advice, how to accompany others, how to have our rights recognized, to have real access to health care, which is essential in our country. This is where there's most agreement amongst us. And we have been working for the compliance of our society with all of our rights, to make true everything that is still missing in the dream. Thanks to the political will of the governor of my province, I started working on the diversity area of the province of Neuquén with the Ministry of Citizenship. And from this position, we have contributed to healthcare access, very significant topics there. These are 2 publications that we presented in the province, along with national publications. Ours specifically refers to our territory and how trans people and LGBT plus people in our territory gain access. We have trained ourselves, we have worked along with primary healthcare centers and with public hospitals as well as private clinics. We have worked on training, in particular to bring to these healthcare staff so that they can learn what the law says, and so that LGBT people will not be excluded from the healthcare system because the healthcare staff is not well informed. This is why we prepared these guidelines regarding trans people, specifically focused on healthcare staff and other guidelines that aim more to the community. Thanks to these publications, we have generated spaces of exclusive medical offices or practices, and this joint effort between the organizations and the state, the government, have caused the creation of exclusive practices in both provinces. We saw the demand as a collective LGBT group, and we were able to create the first trans medical office ever, basically dealing with endocrinology issues to have access to anatomy changes, and also other practices for children and teenagers. That started last year, 2019, to take care not only of the children and teens, but also their families, so that they will have access, if not to hormonal treatment, to access to inhibitors and blockers, so that in the future these children may decide whether they wish to undergo surgery or not. The province of Rio Negro has 3 medical practices that are also exclusive for LGBT people and trans people, and these have been distributed in 3 spots within the province, and those 3 places are the ones that welcome LGBTs and trans, not just for people who go there for hormonal treatment, but also any other healthcare problem, for example, a gynecological checkup. Public health, specifically in our territory, although we have these medical offices and access to hormones is 100% guaranteed as per the law, the offices itself are inclusive, but they do not cover all of the medical specialties, and so what the person may need is not necessarily offered there, but the physicians working in this medical practices, generally generalists and specifically, will refer us to the specialists in the hospital for other needs. Unfortunately, this, which we see in our own provinces, is not replicated in the rest of the country. Other provinces, although they have been working on this, they have been unable to guarantee fully gender identity, not just referring to hormones or surgeries, no access there to other issues that have to do with general health care. Many provinces refuse to acknowledge the law, to abide by the law, and our mates have to travel to a different province if they wish to see a doctor. The fact that in the past there was no law made it so that many would be excluded from the healthcare service. Obviously, if our names were not legally accepted, much less would we have the option to be seen by doctors. There are many places in Argentina where the law is not observed. And in those places where it is observed is not 100%. Those people who receive us at the medical offices are not well informed, haven't been informed. And the trans males in many places do not know that they should have a checkup on other issues, such as having a pap smear or having gynecological checkups. They are not aware how important it is to have this kind of checkup. And this is due to the fact that there are no public policies. And the person who comes to the hospital cannot feel at ease that they will be helped there. In the province of Neuquén, the state-run social or medical insurance has been able to articulate with the Ministry of Health so that they will be recognized exactly as the law says, recognized by the medical insurer all coverage as required by transgenders. And the medical insurance, for example, all of them should give 100% coverage for whatever the trans person needs, be it hormones or a surgery. But not all medical insurances are compliant with the law. In Neuquén, we have been able to make it happen, and nowadays we may say that the state-run medical insurance covers 100% of our needs, thanks to the government, to the work that has been done by the government, and also our own work. On the other hand, the Diversity Director's Office worked on a survey of trans people a few years ago. A report was prepared with specific data. It's statistical figures regarding the trans population of our two provinces. The idea was generating public policies, and the survey would help here. The main data that we found, thanks to the survey, is that 40% of the trans population in Neuquén has no access to health. No access to health. 40% of the trans people in Neuquén. 80% of the trans population of Rio Negro, the other province. One more thing that I would like to comment is that the specific places where trans people were discriminated had to do with the vision of admissions, that is, how admissions is managed. 50% of medical staff, of people in both provinces have been discriminated by admissions staff, basically regarding lack of knowledge of the law, not being conversant with the law. The law says that we must receive dignified treatment, whether our name has been recorded in the Vital Statistics Office. This then has made it so that at many places we show an ID with our name and they won't accept it because of a lack of legal support. As to gynecology, healthcare specifically, and this is something that we trans males have given a lot of visibility to, Gynecological health care has to do with menstruation, gestation, and abortion, and not many recognize this, acknowledge this. Being a trans male doesn't mean being heterosexual, and it doesn't mean having sex with cisgender women. That's not reality. Many of us decide do hormone treatment and then have the option to become parents. Many don't know that there's no obligation to change their bodies. And also, there's others who do want to become parents, and they do so by means of assisted fertilization. Many have had access to fertilization to become parents themselves or their partners. We know a lot of persons that have become parents with this methodology. It's important to communicate this because many people don't even imagine the possibility that a trans male may have menstruation or may undergo a gestation. In connection with gynecological health care, many of us have become parents before the social transition. I am a parent myself. I have 2 daughters, and I have received a lot of obstetric violence when trying to gain access or to have access to prenatal checkups. My rights, my gender expressions have not been respected. This is what used to happen before the society transitioned. When we wanted to have access to this in the past, we were faced with thousands of questions, violent ones, unnecessary ones, as we saw it, and always really trying to harm our gender expression. Lack of consideration from medical staff. Of course, none of us would likes to be discriminated. And the risk you run when you want to have access to this is exposure to risk pregnancies or to STDs, sexually transmitted diseases, and nobody talks about them. No information whatsoever about STDs and trans males. Everybody thinks for a fact that if you go see a gynecologist, whoever goes to see a gynecologist is a female. Well, trans males need to be there as well, so as not to run the risk of an undesired pregnancy or of having sexually transmitted diseases without even knowing that that's a possibility. Many of our mates do not know that they have to be very careful of STDs. Some of them, or many of them, think of undesired pregnancies only, but not of diseases. And there's a number of things in this regard that put our lives at risk. So this is why it is necessary for the government to inform people how important it is to take care of their bodies, not just because of undesired pregnancies, but also because of potential diseases, which are a problem for us because of a lack of information. Our organization believes that it is necessary that those networks we are connected with be expanded, extended. Other organizations of the LGBT community plus, and the work with people who are in the healthcare system, public or private, should get together in order to cause this transformation, which is so necessary and which would give us real access to a comprehensive health care and for the full recognition of our human rights. Full recognition of our rights and real access to health care. Thank you. AIDS 2020, good morning. I'm Erika Trejo, a member and representative of the trans community for the NGO Impacta. I have a degree as a medical clinical laboratory technologist at a hospital of the Ministry of Health in Peru, and I will talk about how to educate our community on prevention clinical trials in the city of Lima, Peru. First, some basic notions. What does it mean to do community education on clinical trials with the trans community? It is an intervention carried out by the trans health professional and the community engagement team of Impacta, along with the trans community of Metropolitan Lima, for the sake of educating attendees regarding HIV prevention clinical trials. Objectives first, giving information to the community regarding HIV clinical trials. Number two is preparing community-based settings before the clinical trial is implemented. All of the above is done within the framework of recommendations and guidelines of different institutions that have pointed out the importance of preparing the community and acknowledging their approach, their info, their needs. In 2016, the UNAIDS prepared a report of good participatory practices, and in 2014, community partners presented a recommendation for community participation. This is our strategy. We will take the strategy of community houses. Trans community houses is an approach working with the trans community itself without disrupting what they do in their own spaces or settings. Also considering that they have little info on on clinical trials and on sexual health, and they have a low educational level too. Unfortunately, this had made it so that they show no interest in these topics. We also agree with the collective I Am Not Afraid, which in 2016 identified that the community has no access to education. How do we do this? How do we make it happen? We have a plan that takes 5 steps. First step, mapping and reconnaissance of the trans community. It's like a snapshot of Lima. And then you identify 4 areas or cones, and you will see where sexual work takes place, where there's transvestite houses, or where there are hairdressers. All of this has to do with the personal knowledge of the healthcare professional, in this case myself. I've been working for many years on this topic, and I have ample experience. The girls also recognize me. We also base the activity on information. The girls may tell us about new places that have opened up, or new hairstylists, etc. The second step is identifying leaders for the purpose of effective coordination and access to the space of trans girls. There are certain girls that have a degree of influence on other girls. The other girls follow them because they are mostly mothers to other girls who are only just getting started, and so they talk about how to carry a hormonal treatment or how to lead a life as a trans. It's girls that have experience with the police, with watchmen, so they are good referrals. The third step is the invitation. We will describe the activity of our proposal to the leader. We will distribute material, lubricants, preservatives, preventive material for the purpose of ice breaking, of improving communication. When you give a girl a condom or a lubricant, they know what it's all about, what you're there for. The third step is coordinating with the community. This is, for example, the site has a manager. We need to talk to the manager of the site where the event is going to take place. We ask for authorization to be there. We identify the day. Then we talk to the leaders. We talk to each one of the girls because this is a tailor-made approach. Each girl is informed, and then we coordinate the activity for a place, date, and in a duration that will not interfere with their activities. If the beauty salon is full at 4 or 5, I need to be there 2-3 hours in advance. The same if they start working at 6, I have to be there ahead of time. The next step in how to do it is coordination with Impacta, what the topic is going to be, who the presenters are going to be, the agenda, logistics, condoms and lubricants, having lunch with the girls on that day, because they have daily problems, and perhaps with the police or with watchmen, and so we try to talk to them, and also educational materials, brochures, etc. This is the Impacta community engagement team, and that's the chief, Mar Leon. The fifth step is carrying out the activity. I will be there an hour ahead of time and before everybody else is there to make sure the place is okay, clean, tidy, there are no distractors. Then a reminder is sent to the girls an hour ahead of time. Then we group the attendees at the place. And as we see here, there were more than 25 girls in this meeting, 20 girls in this other one. All of them had been very expectant regarding this activity, and they are all very happy. They do look happy and smile because they have talked about their own problems. Where do we do this? I will talk of the trans houses with over 25 girls, 30 maybe girls in the houses. So the Transgender house is in the metropolitan area of Lima. They share bathrooms and they have a room. There's overcrowding. Most of them have not finished elementary school, and they come from the 3 different regions of Peru. The second house is the Beehive Trans Colmena house. There's very small rooms and shared bathrooms. There's also overcrowding and slum-like living conditions. 90% of them come from the Awahun community, very young girls, 15 to 24 years of age, mostly not having finished primary education, and many have TB. The third house is the Northern Cone Casa Hotel, and we see the women coming from the 3 different regions of Peru. They are low and middle class. Most of the girls have not finished high school studies, and they are almost exclusively sexual workers. The fourth house is the hairstyling store or salon at the Gamarra Commercial Emporium. It's the largest commercial area in Peru. And the main characteristic here is that most girls have completed high school studies, and most of them are hairdressers. They are also a little bit older, 25 and up. So, a comparison of the four houses that we visited. The first item on the table is demographics. We see that the two houses in downtown Lima, there's overcrowding and slum-like living. That does not happen in the other two. One detail here, downtown Lima, in the second house, the girls come from the Awajun community, and these are girls that are going to be doubly stigmatized because they belong to the trans community, and they are also native indigenous population. They have run away from their place. There's no slum-like conditions in the last two houses. What about studies? In the first three, we see that none of them have completed their schooling. That does not happen in the fourth group, where they have completed high school. The downtown Lima houses and the third house, they mostly do sexual work. This does not happen in the last house. So all of this shows that there's micro-trans populations. They're not all identical. There's the Awajun community girls who are much younger, no education, and there's others who have had an education and they devote to a different activity, non-sexual, which is hairstyling. Considerations. It is important to approach the community with the idea to learn from them, with this mindset. Not all micropopulations are the same. Some have had no formal education, so that means more barriers to be overcome. Different skills and perceptions require more time and other strategies. We always have to be transparent in our approach, always tell the truth. We try to develop their skills and look for the leaders. At all times, try to keep our commitment up and for the long haul. What benefits for the trans community? First, getting info on HIV treatment and prevention. Two, we are looking for creating awareness regarding how vulnerable they are to HIV and other social risks. Say a girl has a partner and then they break up, the partner leaves, goes to another partner, and then the first girl finds another apartment. We share partners, and this creates an epidemiology risk for us. Another benefit is learning how to connect to healthcare services. They have been given cell phones, they have WhatsApp connections, and that's how they can get the right healthcare information, where to get a hormone treatment or antiretroviral treatment. And also the info is given by peers, by a recognized referent. It's us who talk about our own things, and this creates trust. Conclusions. It is important to do community education to prepare the trans population before initiating the clinical trial. It is necessary to identify the characteristics of micropopulations before approaching them. A community also regards positively any strategy when it's implemented for the long term and with commitment. It is important to keep up working hand in hand with institutions, with organizations that have an institutional approach like Impacta. Very well, thank you very much. I'd like to thank the NGO Impacta for having invited me to participate in their Community Advisory Committee and for having funded our effort by providing logistics, materials, technical support, staff, and refreshments. And I would like to express my thanks to Fundación Huésped for their invitation, in particular because they are internationally acknowledged by our community. Thank you.
Afternoon. Thank you for being here with us today. This is the Q&A session, a live session. First of all, we'd like to thank you for your patience. We know there have been quite a few technical issues to log on to the session. This pandemic has taught us all to be patient and to develop empathy for others. So thank you very much for the technical team and everybody who has made this possible. We would also like to thank you for being here. We know this is not an easy situation in our countries. Most of us here are healthcare workers or are working with the communities that are most affected. So thank you once again for taking this time and for the work you do every day for each of us. Members of the audience may ask their questions using the chat slot. While we wait for the questions to arrive, first of all, we would like to congratulate you. Benjamín and Erika, your work is really outstanding. How much you have achieved and how you have created bridges with the healthcare system. Benjamín, I have a question for you. You shared with us the difficulties you faced with the healthcare system, the obstacles you encountered. What do you think about the current scenario? What has improved and what still has to be improved from the healthcare system point of view? Can you hear me well? Yes. Thank you very much. We believe that what has to be improved in the healthcare area is, first of all, getting the gender identity law to be fully enforced by the public healthcare system and by the private healthcare organizations. And it's also necessary to expand everything related to pregnancy or gestation. Trans males in Argentina are trying to get this into the public health agenda because there are many trans males who are fathers. I am a father myself, and having access to a healthcare system that supports us, that takes care of us, well, it's not possible yet. It's very tough when you have to go to a healthcare site where you're discriminated against because the professionals don't know that trans males may get pregnant. And this is what we face because gynecological health is the second most important thing for us. And it's hard for us to have access to it. Do you believe that any progress has been made? Yes, progress has been made. Not throughout Argentina, this goes by areas or sector. A lot of progress has been made because there is visibility. This is a huge step forward. The fact that we are sharing this meeting with you, this is very important for us. And it's a step forward because it gives visibility to our realities. Our task as organizations or activists is related to that. Historically, the healthcare system hasn't taken care of us because people were unaware of what we needed. So, by gaining visibility, a lot has been improved. Erika, could you please tell us about the work you do at Impacta? Can you hear me? Yes, okay. First of all, I would like to thank Impacta for having appointed me as the trans representative and for having given me all the logistic support and the professional support so that we could go to these houses, to these homes. We have been able to survey a lot of information about the trans community because of the problems we face. The trans girls, and well, I myself go to the places where trans girls live. We go to their beauty parlors, to the places where they do sex work, so as to give them information about research, projects, clinical trials, about healthcare centers that provide hormone treatment, HIV treatment, treatment for STIs. So this is the key work we do. We go to the homes where the girls live. Benjamin, I go back to the previous questions. We are going to take turns in asking questions. You mentioned in your presentation that there was still a long way to go in the area of STIs. And my question is, what suggestions does your committee have for the research teams and for the healthcare system, for the healthcare teams? What suggestions you have on how we could carry out STI work with your community? For us, it's very tough because there's a lot of lack of knowledge. The trans masculinities sometimes don't know how important it is to know about STIs. We are very exposed because there is disinformation on both sides, on the population's side and on the healthcare system side. Though the healthcare system promotes caring for your body and your health, it does not include us, the masculinities, as their target population. The fact that we don't have visibility leads to the boys having questions like, well, many of the questions the trans males ask is, well, whether they could get pregnant if they are receiving hormone treatment, if they have to use condoms, because as they are receiving hormone treatments, they believe they won't get pregnant. This is a risk they are continuously exposed to because of the lack of information. They believe that condoms are only good to avoid getting pregnant. They are not aware of the fact that they have to use condoms to protect their bodies, not only to avoid getting pregnant. So this could be changed by things like what we are doing now, getting together and working jointly to get those realities to be known, and so that the information gets to our brothers, because we, and I myself, when we live in a big city, well, it's easy, but it's tough to be a trans person in a rural, suburban area because it's very difficult to have access to that kind of information. So we should work together jointly, and this would be wonderful. It is wonderful, actually. What you're doing right now is wonderful. And this is a question for you, Erika. You have been working for a long time with the medical team. You have been working on educating the population on research projects and trials. My question is, how do you carry out the mapping? How do you get to the places like beauty parlors? And on the other hand, which are the main barriers, fears, or concerns the community has when it comes to participating in research projects or trials? As a matter of fact, we get to those places. These are places where the trans girls have historically been present. There has always been sex work. This used to be homes or hotels where the girls have lived for many years, not one or two, but over 10 or 50 years. It's places where they come and stay. They come from different places, from the forest, from the mountains, and for example, new beauty parlors may open and many girls go there. They go there because the managers are understanding, because they respect them, and it's normal for them to work with trans girls. That's why we go to those beauty parlors. And sometimes the leaders tell us, well, a new beauty parlor has opened up in this district, or this is a place where there are many trans girls, or a new hotel has opened up in Independencia. So they refer us to those places. They are the ones that tell us where trans girls meet or gather. And the question about the main fears when it comes to participating in research trials, well, the main fear is related to lack of knowledge, because the trans population doesn't have too much access to education, unfortunately. So we go to those places, we communicate the research projects, we tell them that blood will be drawn, and we use other girls as examples, because some other girls are already participating in research studies and they are our examples. They tell the other girls how they have been taken care of. Of course, it may take 4 or 5 hours, but it's time you have to devote to your health. It's like being a car. A car needs maintenance, so our bodies need maintenance too. Our health has to be checked. They have to find out whether we haven't acquired an STI. So we have to devote 1 day a month to your body to know how you are doing, how you are faring. And I also share with them my experience, because I have been involved in a couple of research trials. Thank you. Benjamin, there is a question from Juan Jotelo, who asks about the inclusive medical services in Viedma. At what hospital are they rendered? Whether you are present there, and whether something has been done in the province regarding the trans employment quota. In the province of Rio Negro, well, the medical services in Vietnam are provided at the Vietnam Hospital. It's a public hospital, and the trans employment quota in the province of Rio Negro, it is already a law. It was passed 2 or 3 years ago. The point is that this law in Rio Negro has to be ratified by the municipalities, because it's a provincial law, and this has been done in some places but not in others. And this is a battle that still has to be waged in Rio Negro, so that the trans employment quota is complied with. And this is a battle which we are fighting in the province of Neuquén too, because the first project related to trans employment quota was submitted to Parliament in 2012. 4 more projects have been submitted to Parliament, but nothing has happened yet. I have another question for Erika. Erika, I really like your work, so please forgive me for asking so many questions, but I'm quite excited. I would like to know whether you have identified any characteristics. Many clinical trials or intervention trials require quite a big time commitment. Some hours they have to go to the hospital, but several visits to the hospital along a couple of months. So what strategies do you use to keep the participants in the trials? And whether you have identified any patterns in those who stay in the trials or those who drop out? Well, as a matter of fact, that intervention we made in the homes showed us that the female trans populations include several micropopulations, because some trans girls come from Gamarra or from capital cities, so they have completed high school. Some of them have high school degrees, so they have a different educational background and they are interested in these issues. And this is quite unlike what we find among the girls who come from the indigenous communities, from the Huangum community. Those girls haven't even graduated from grade school. They are 14, 17, 18 years old. So it's harder to work with them. It will take more time. We have to use a simpler language. And the other girls, the ones that are better educated, some of them have completed grade school and they are living in downtown Lima. So this has to be taken into account. The female trans populations include micropopulations, and we have to take this into account because depending on who we are talking to, well, we know when it will take us more time to keep them in the clinical trials. Do you have any further questions? Thank you. I have another question for Benjamin. You said that the group you work with includes children and adolescents. So, how do you work with the schools on the issue of com- comprehensive sexual education? How you are dealing with that working with the people and with the educational community? How do you tackle this in the region? What suggestions do you have regarding comprehensive sexual education? Our organization does the following. Well, when we are able to work with other organizations, we do so. We work quite a bit with the teachers union in our province. So this union supports us, and through them we get to the schools on the teacher training days. So our brothers go and share with them the situations and what they face every day in the schools, being students or being teachers. We have worked a lot on these issues in our province, and we support the children and adolescents in their transitions, and we also support their families. We work with many families. Unfortunately, most of the families have a family member who is a teacher. So this helps us to get to the schools. In the area of comprehensive sexual education in our province, this is the act is complied with because of this commitment of the teachers union. And at the schools that we have visited in the province, the law is complied with, and that helps quite a bit because teachers are teaching this in their classrooms every day, but they also have information to be able to support our brothers and sisters in their transition. They are able to help them answer questions regarding sexuality, for example. Well, I believe time is up. I would like to thank both Erika and Benjamin. I would like to congratulate you for your work, what you have built along these years, what you have explained in your presentation. It's like work you do step by step, but with very good results which can be seen. And I would like to thank you for having been able to participate considering the current scenarios. I would also like to thank you for your work, for your commitment, for having joined us. I would like to encourage you to keep on working jointly as part of a network, exchanging information, and I would like to invite you to future sessions. And I would like to thank all the participants for your time. And of course, I would like to thank our sponsors, the ones who have made this possible. It's very important for us to hold the Transgender Symposium in Spanish with simultaneous translation into English and Portuguese so that it is useful for the whole of Latin America. Thank you very much. Thank you. Thank you. And I invite you to keep on working as part of a network. And I would like to thank you and Fundación Huésped for having given me the opportunity of working with you. And I hope I will be able to participate in future trans conferences. Thank you very much. Thank you. Bye.